everybody.
Hi guys, it's Leah.
And Dr. Buff at Advanced Health and Wellness Center. I thought we'd let you go first.
Thanks.
Yeah, no problem.
Switch it up.
So we wanted to talk to you today about phase 2 of our joint rejuvenation program. So if you remember, phase 1 was reduce inflammation and create motion and get some lubrication in the joint. And for that, there's lots of different ways that we do it. One of the ways was using hyaluronic acid, which is covered by insurance. It's an injection series that if someone qualifies, their insurance covers. So phase 2 that we wanted to talk about today is stabilizing and then kind of starting the improving the positioning, I guess you could say. So the alignment, the structure, focusing on the structure. That's good. Focusing on the structure. So can you describe that phase 2 using, there's different bracing that we do, chiropractic, starting to stabilize, starting to do some exercises to create better stabilization.
Yeah, so braces help with adding stability, especially in the case that you have the type of arthritis where only one side of your joint is more severe than the other. So they make what's called an unloader brace, which we use frequently. It helps while you're walking to take weight off of the bad side and put it onto the potentially good side. That's not for everybody. You have to qualify for that type of brace. But the braces we use here, they're DME equipment, so they're not something you could just buy at the store. These are much better and stronger and sturdier than that.
Well, hang on. So they have to be prescribed.
Correct.
And you have to fit certain. They have to be medically necessary. So you have to fit certain parameters in order for it to work. Correct.
Definitely.
It's not something you can pick up from the CVS.
Right. And rehab. So we do some rehab in this phase 2 where we're trying to strengthen and stabilize the muscles, tendons, and ligaments that are surrounding whatever joint and holding it together.
So that could be shoulders. So there's specific things that we would be doing to work with the rotator cuff to, again, stabilize the joint. Or the knees, we're looking at the ligaments, tendons, muscles that surround the knee, working with those. Or the spine, right? So we're still, in those braces, we're talking about braces that put us into a good position that unloads. That could be the lower back or that could be the knee. That unloads the joint, right?
Correct.
And they're specific to the individual. So they're customizable, whether it's an outside that needs unloaded or inside that needs unloaded. The braces are actually fit to the person
right
as well. Cool, so that's phase 2. So we're setting up for this 3-phase process of getting better motion, reducing inflammation. Phase 2 is we're starting to stabilize, work with the alignment, and improve the structure. And then phase 3, which we're going to talk about next time, is regeneration. So we're going to start working on helping the body be able to stimulate healing of the joint, the body healing itself, giving it the nutrients and the resources it needs to heal itself. So I wanted to also talk about a patient, Carl. I talked to Carl today, and it was really cool. He told me he was on a golf trip with some of his buddies. Now, Carl was supposed to never be able to golf again, right?
Yeah.
Remember? And what did they say? This was 18 months ago, 2 years ago. He was going to have a hip. They said your only option is a hip replacement. Do you remember that? And you said,
that's not your only option?
That's
as
right.
As we're concerned?
That's right. So Leah said, no, it's not. I want to get that straight. So it wasn't, she didn't say that this doctor was wrong or whatever. The doctor limited this person. And so please don't allow that to happen. Don't allow any doctor to limit your choices. So the doctor said, you're going to need a hip replacement. That's your only option. Leah said, no, actually that's not true. You do have options. So some of his problem was his spine. Some of his problem was his hip. How long did it take for Carl to start getting well?
Probably several weeks.
To start having less pain, but actually for him to be able to get back to like playing golf and doing all those
months.
things.
Yeah, it's not
No, so he's a good example.
Yeah.
You're like, what are you asking?
Where are you going? You want me? It's long term.
His was months.
It's long term.
It took him almost over a year
Yeah, probably.
to really get to where he was like, holy crap, I think. So this is 18 months to 2 years later, and he said to me, this is the best I've felt in years.
Nice.
Yeah, I was actually feeling great, and he's gotten older, which means typically they're saying, well, the older you get, the worse the problem is going to be, which is what they told him, and it's actually gone in the opposite direction. So I want y'all to be aware of that. So we're going to discuss these things in detail in the webinar that we're going to be going over on joint rejuvenation that you can register for. So we'll put the registration link to that on this video. But it's a great story, and there's a lot of people out there that are suffering, and they don't need to be suffering. We want y'all to get that information. Anything else?
No, I don't think so.
Send this to somebody that you know is complaining about problems that has been limited in what they've been told their options are. Cool. Have a great day. We'll talk to you soon.
Bye, guys.